Righty. I have 12:05. Let's go ahead and begin. Good afternoon, everyone. My name is Lena Watts, and I'm the Secretary for CAHAM, the California Association of Healthcare Admissions Management, and I welcome you to our webinar. And the webinar today will focus on how to successfully use robotic process automation and artificial intelligence to manage denials and appeals. Today, we have two special ladies who will join us, and the objective today is to understand robotic process automation and artificial intelligence, the basic principles associated with each collection of technologies, and the current and future use cases for each in the revenue cycle. We're going to learn where to start and how to put together a plan and a team to build, implement, and document these technologies in the revenue cycle. So let me introduce our wonderful presenters today. We'll start with Andrea Rivera, and a graduate of Fordham University. Andrea has over 25 years of experience with Jzanus, where she has touched every area of the healthcare revenue cycle and now leads information technology for 6 organizations and over 500 employees. Under her leadership, Jzanus' team has integrated RPA and AI into the workflow, among many other successful initiatives. Andrea is a member of the HFMA Technology Committee. Our other presenter is Sandy Mooney. She has been with Jzanus over 8 years. She has 20 years of experience in the healthcare industry, coming from 2 prestige health systems in New York, Memorial Sloan Kettering Cancer Center and Mount Sinai Health System. She has a strong background in business and operational expertise in leading diverse teams to new levels of success. Sandy has evolved the clinical appeals department, demonstrating the ability to develop innovative solutions that enhance and automate the clinical denials and appeals processes in the highly complex healthcare industry. She also leads a team of seasoned clinicians that have an in-depth understanding of both clinical and administrative requirements to successfully overturn carrier denials with revenue recovery opportunities, both financially and clinically. So please join me in welcoming our presenters, Andrea and Sandy.
Thank you so much. I'm just going to share my screen. Okay, perfect. Can you guys see that?
Yes.
Excellent. So I'm Andrea. I run the IT department at Jzanus. I've worked for the company for over 20 years, and I've worked in a lot of different areas in the company. So I really appreciated that introduction. I started in the mailroom back in the 90s. I worked as a biller, as a follow-up representative, as a supervisor before I shifted over to the IT side of the world. And the reason I say that is so that you can understand the approach that we're taking in bringing in robotic process automation and artificial intelligence, it isn't only a one-dimensional process. It's not something that your IT team takes on by themselves in a vacuum and they make all the decisions and they guide the process. It's something that happens with a team mentality from all levels of your organization. You're going to need your management, your operational management, in addition to your IT, to be involved in this type of initiative because it impacts everyone and it requires everyone's expertise. That's a little bit about me and where I'm coming from when I'm talking about these things. So Jzanus is a revenue cycle management and IT firm based in New York. We take on receivables from many different types of organizations in the healthcare industry, hospitals, physician groups, radiology, anesthesia, and we sell software solutions to help people manage their revenue cycle as well. So we're coming from a background of having actually implemented these technologies in many different ways throughout our organization. But what we're going to focus on today is how we built them and how we were successful with building them, particularly in the denials and appeals industry. And Sandy obviously was the resource on the operations side that led that initiative. And I was the resource on the IT side that built it. So over the past 5 years, we've done that. We've integrated it. We've been successful with it. And that's what we're going to talk about today. So one of the first questions you want to ask is, why do we want to do this? Well, one of the biggest problems facing the healthcare industry today is staffing issues. We have seen some major issues with finding the staff to manage your revenue cycle. And almost every job within a hospital organization, we've been really struggling with staffing. And the reasons why are obviously started with COVID. We encouraged retirement when we needed less staff. We had issues because of vaccine refusal, huge issues because of staff burnout, people, working double shifts constantly through COVID, and they really don't want to work in the healthcare industry anymore. They've dealt with some really challenging patients, and they don't want to come back is basically where it comes down to. So we've seen this open up a little bit more, but healthcare industry, we're really seeing those job cuts continue, and we're not able to fill those positions as quickly as we used to be. So that's one of the reasons why we would say now is a great time to start bringing in more automation, because you're really not able to hire the people to do it the way you would in the past. And we're not seeing that change significantly over time. We've seen some increases in our ability to hire, but we're not back to where we were before the pandemic. And we're definitely needing to offer people more help, more higher salaries, better benefits. All of those things have increased as a result of COVID and our staffing challenges. And we're just not seeing that there's going to be a change in that. And that's what it really means for us right now. On the HR side, on the operational leadership side, we know that if we could hire 50 people to do the job that we need done, we would do it because we're comfortable with that solution. It's what we've always done. But unfortunately, it's not possible due to these staffing challenges that I've been talking about. And so what we have to do is get comfortable being uncomfortable. And let's talk about the COVID acceleration. So what is the COVID acceleration? Well, it's the changing viewpoint from all levels and roles within an organization towards technology. And what we saw in a 2020 McKinsey study is that COVID has really pushed companies over the technology tipping point and transformed businesses forever. Because what we saw through COVID was companies that adopted technologies faster were a lot more successful. And I'll tell you that that was definitely the case at Jzanus. One of the first things on this list on the screen is increase in remote working and collaboration. So we already had the infrastructure in place to have people work remotely. What we didn't have was that expansion, right? We didn't have 300 laptops for every staff member, but we did have the token system, the multi-factor authentication, and the ability for people to work remotely. So what we had to do at the beginning of COVID was expand that, not build it. And that put us in a good position. We just had to make sure we could purchase enough laptop devices for our staff to utilize while working remotely. I'm sorry about that. We were able to expand quickly. We see that in so many other areas as well. Customer demands have changed as a result of COVID. People used to expect that they would have to go into a doctor's office. Now people are expecting virtual front door. They're expecting telehealth. They are not expecting only a in-person doctor's visit. We've seen an increase in digital transactions. 41% of customer interactions were digital previously, and now 65% of the customers are expecting to be able to interact digitally. There's a shift also in products or services that are digitized from 41 to 60%. So we're expecting to be able to offer digital solutions. We've seen this trend even in healthcare with a rise in use of things like digital front door. People expect to be able to remotely register with the doctor, sit in a virtual waiting room instead of a physical one, and be able to come into the office when they're actually able to see the doctor. Automated payment solutions are something that people are fully expecting. And of course, the huge rise in telemedicine. So according to Medicare statistics provided by HHS, use of telehealth alone grew 63-fold from 2019 to 2020. There were 840,000 telehealth visits in 2019. In 2020, there were 52.7 million. We've seen that number come down somewhat now that things have opened back up, but we'll never see the same expectations from our customers as before. They expect to be able to do a telehealth visit if they're not able to do an in-person one. And we want to make sure that that ability is open to them. So what we can expect to see if everything stays with the same levels of staffing and our volumes remain where they are, we're gonna see large drop-offs in our revenue recovery, and our ability to do our jobs and stay in business, in essence, rely on our ability to collect, right, within the revenue cycle. So we have to make sure that our focus is on recovering that money. It can't only be on trying to hire people. So now we know what we want to do, why we should do it, and why we should do it now. So the next question is, how do we take advantage of the prioritization of technology initiatives that now all of people within the organization are recognizing as being critical? So there's a few ways we can do this within the revenue cycle. And let's talk about robotic process automation, AI, and what I think is often overlooked, which is rules-based automation. So what are these things and how are they different? Robotic process automation is simulating a human's actions in a process. Things like mouse clicks when retrieving information from an outside website, those types of things. Those are ways you can use robotic process automation. It tends to focus on repetitive tasks, not critical decision making, but simply retrieving information and taking simple decision making. So one common use is to simulate going out to a payer website, retrieving claim status, eligibility, authorization data, and bringing it back into your system and expecting to do something with it. So robotic process automation, because it's simulating those simple processes, can help you to improve your speed and your efficiency at a low cost and with a low error rate. Machines will take the same steps over and over again. They won't incorrectly transcribe the data because they just won't, right? That's what they're built to do. They'll do what they're built to do. And that helps to improve consistency, accuracy, handle repetitive tasks, which benefits employees. You know, one of the employees where you're going to see the highest turnover is those low-level employees. If the job is boring, they're not that likely to stick around, right? So we help to focus their attention into these higher value tasks and give them more autonomy in the process. So overall, that definitely benefits the employees, and robotic process automation can help lead to use of other technologies. I'm going to skip artificial intelligence and go to rules-based automation, just because I think they're a little bit more simple, and we'll finish on artificial intelligence. So rules-based automation uses data already within your system, and it acts on that data, right? It tends to be simple things the same as robotic process automation, but it's a little different because it's internal programming rather than external programming. It's not simulating mouse clicks. It's making changes within the database based on particular triggers. And those triggers can include information that you're retrieving as part of the robotic process automation, right? So you go out to a website, you retrieve claim status information, and then you take an action within your host system as a result of that. So it uses that information that you already have. And the reason I like to talk about this is I think that people feel like maybe we've been doing this for many years, and we have, but there's a lot more ability to do it. And as we bring in more information, that ability just grows. So I think rules-based automation is something we turn away from because we're focused on artificial intelligence and robotic process automation, but it has a lot of potential to continue to grow and to grow an organization. Again, it's low risk. It handles those repetitive tasks and benefits your employees. And it does have more limited use cases because it's something that we've been doing for a long time. So it's not something that's new to us as robotic process automation, artificial intelligence are. So artificial intelligence, let's come back to that. And how is it a little bit different from AI? Well, AI provides the data and lets the computer make the rules. So AI is great for when we don't know what we don't know. We don't know what factor is impacting this inventory, so we build an AI. When we know the next step we should take, we build robotic process automation or rules-based automation, because it's just a decision tree. If this, then that. That we're building with those. Artificial intelligence is figuring out what the if is and what the then is for you, right? So artificial intelligence also helps you to improve speed, drive efficiencies, improves user experience and interfacing. But you have a higher risk of error because you're not programming specific rules. You're allowing the computer to look at large sets of data and make decisions. And that does come with a higher risk of error, with more detail required, and a need to consider more carefully ethical concerns. And those have come up a lot lately, particularly with the implementation of ChatGPT and its wide availability and use, right? ChatGPT is a hot topic. We can all access it online and see how well it answers questions, how effective it is. But you can also ask it a question and get a wrong answer, right? I don't know if anyone's seen, these YouTube videos where they'll ask it a question, get a wrong answer, but it's really interesting, and it'll self-correct when you correct it. But there is that ability to see these errors coming through with ChatGPT, and that does raise a lot of ethical concerns. Some years ago, Microsoft put out a Twitter chatbot called Tay, and they allowed it to be trained by what people were posting on Twitter. And I think as I'm saying this, you can see why that's a bad idea. You don't want anything to be trained by Twitter users. So they quickly were able to make this chatbot offensive. And Microsoft, of course, had to shut it down. But they've been a lot more cautious with ChatGPT, and those lessons learned have really increased our ability to consider artificial intelligence. We do see right now, it's a reinforcement learning with human feedback model, and they do see these kind of ethical issues and try to correct them on the programming side as time goes on. So it's a very supervised model of training. But we are still worried about the ethical implications of such large AI, where it's general intelligence as opposed to more narrow AI, where you may be asking it to do a very specific task or look at a small inventory or a large inventory, but with a narrow focus. So a narrow AI has less risks than a large general AI like ChatGPT. And therefore, there kind of is an ability to use them in the day-to-day without such large concerns over the ethical implications. What we do have to be careful about, when I was saying, on Twitter, we're allowing the tweets to drive what this chatbot is learning. We have to be very careful in our training data and just make sure that we understand the inventory that we're looking at, right? So understanding all that, I'm just going to let Bill Gates say it because he says it best. The first rule of any technology used in business is that automation applied to an efficient operation will magnify the efficiency. And the second is that automation applied to an inefficient operation will magnify the efficiency. Same as with that training data. If you understand what you're trying to accomplish and you're doing it well manually, you'll be able to replicate that process very effectively with electronic intervention. But if you're not doing it well and if your data is not good, you're not necessarily going to see the same results. So the next question we want to ask, we're going to get really practical here and talk about how you start thinking about and working on something like this. It may sound counterintuitive, but we start at the end. We start by defining what our goals are. Understanding your goal is critical to your success. It sets the tone for your entire program. One thing I want to say, when we started at Jzanus trying to build robotic process automation and artificial intelligence, our goal wasn't to replace staff. It was to change their roles from a follow-up representative to an analyst, meaning instead of working account by account, they're looking at accounts from a higher level perspective in groups. we have 30 cases with this denial. What am I going to do with these 30 cases? As opposed to saying, why was this account denied? What am I going to do next? So it changes their role. It makes their position more valuable. And that's really important, because the end game that we're trying to accomplish, this goal, is to make the people that we need complicit in the implementation more important. And so that helps to get their buy-in, right? They're going to help us build this robotic process automation, implement this artificial intelligence, because at the end of it, we're still looking for them to be part of our organization in a higher level role. Reasons why I've seen people not be successful with this is they kind of put it right out there at the beginning, that their goal with this process is to replace the staff. It may be a side effect of building this, that you're able to operate with less staff, but making it your goal is going to be detrimental to your process and detrimental to the buy-in that you get from the people that you really need to buy in. So starting with your end game again, once you know what your goal is, you're really going to be able to look at and consider how you get there. So saying, I'm trying to make my staff more important, I'm trying to make their work easier in this way, we see where we're trying to get. So it makes all of the steps in the process easier to accomplish, right? So we start at the end, we start with what our goals are. And on that note, I'm going to turn this over to Sandy to talk about what our goals are and what we're trying to accomplish here.
Thanks, Andrea. Yeah, so as we said earlier on, I have been working a couple of years now in, creating RPA with denials and appeal processing, which is where my focus is here at Jzanus. So with that being said, as we continue to understand the robotic processing automation, artificial intelligence, and rule-based automation, where can you begin to apply? In our industry today, denials is definitely one of those leading problematic areas in our revenue cycle. So there's 3 parts in our revenue cycle, as you can see here. We have patient access, which is your front end. This is your registration and eligibility. And this also includes that pre-authorization verification process, which is very important. You also have your charge integrity, which is your middle. Here, charges are captured on the bill from the service and then submitted, obviously, to the payer. You want to ensure that the hospital is getting your full reimbursement. And lastly, you have your patient's financial services, which we consider the end of the spectrum, and claims are being processed and denial resolutions are being captured on this side. So there are a couple of things happening within the cycle. So this kind of brings us to the question of the day. Why are denials then continuing to rise? The Change Healthcare 2020 Revenue Cycle Index shows that denials have increased, obviously, since COVID-19, which Andrea got into that a little bit in detail as well. And it nearly shows that even 72% of the largest nation's insurance carriers literally just went back to business as usual. So as if nothing had changed, nothing had impact. So how do we get now, forward from that 8 ball? How do you get to trying to capture those denials on time? So a few of those denial reasons that we're seeing across the nation is lack of denial resources, staff attrition and training, growing denials backlog, and the lack of technology. And just doing a little bit more of a deep dive on those denial reasons and understanding within the revenue cycle, how to accomplish those SMART goals. What we're seeing today is our top outpatient reasons are registration eligibility, benefits limited, exhausted, no authorization, which is huge, services not covered, medical record documentation. And in our inpatient, we have clinical validation, inaccurate code assignment, also medical record documentation, medical necessity, and then lack of transparency from the payers and any audit vendors. So here is where I'll talk a little bit more about the built-in creation of RPI regarding denials and appeals. These are just a few items that we as in our company have already have implemented and are live with a lot of our clients. So one of them being is built-in timely filing. It's really about uploading your payer timeframes and adding auto calculations from either billing, corrective claims, and appeals into your system. Perhaps even adding a flag or an indicator that will allow you to monitor the due dates, so you're eliminating those untimely billing or appeals. And the system will help identify such cases by prioritizing them, again, by their due date. The next is coordination of benefit management. If you recognize a set of accounts that are denying, let's say for COB issue, you can create some sort of a logic where the system can identify these denial reasons upfront from maybe perhaps your 835 reason codes, automate a simple patient letter that will then be just requesting to the patient if they can please update their insurance. And then once that letter is created, you can mail that letter out to the patient. Again, it's as simple as just eliminating those 1 or 2 manual steps in between that process, and perhaps even repurpose the staff to work a more priority work queue. Third is authorization discovery process. You want to create a seamless automation logic of authorization statuses, responses from the payer portals. They can give you authorization statuses such as, is your authorization number being approved, denied, or still pending? Capture authorization detail further and identify what codes are being denied by how many number of units, the denial associated to it, the diagnosis code or CPT codes. And then what this information up front will do for you is we'll be able to actually give you the ability to classify those root causes in a timely and accurate manner, especially on the no authorization denials. And we see that a lot across the nation. With this information, then in addition to that, that will decrease, again, the manual time spent on the phone having to validate, is this authorization approved for this data service or service? You can continue building a lot of automation around this, actually. If your facility even already knows the codes that require or do not require authorization, that's another logic or table that can be implemented within your system to be able to move accounts in bulk. Auto reconsideration and appeals. You want to be able to have the system submit an online dispute for reconsideration of payment and to avoid any manual intervention. And most important, limit those long hold wait times on the phone. Know your top payer mix, that's important, and what payer portals have the ability to submit the process of appeals electronically. Most importantly, looking out for those root causes in which they're denying you incorrectly. You want to be able to automatically push those back quicker rather than wait to see or have a human follow up on the denial to identify it's an incorrect denial. It's definitely a huge time saver. Next is the work queue drivers. We use these a lot, actually. This helps the staff and the management staff support in managing their accounts. It lets the management team to better understand what their staff is doing and prioritizing during the day or what they're not prioritizing. You can also use focus points within the work queue to help drive expectations for the day, such as working maybe by payer, higher dollars, denials maybe not touched over 30 days, or any appeals that are due, within the next 24, 48, 72 hours that you have to get out the door. So work queue drivers allow for full transparency of staff productivity. Appeal management. So this is designed and tailored to letter templates and insurance forms that drive your top denial type, service line, root cause, payer. You could even include contract language or clinical criteria. It's as simple as having the system auto-generate a letterhead that already has some patient demographics and insurance information. This will allow for the clinician team to spend a little bit more time on that medical chart and looking for those meat and potatoes or comorbidities of the patient in order to have a more successful appeal. You can also reduce the manual effort by auto-tracking your appeals. The system can try to find some sort of alert or notification when the appeal has been received and delivered already at the payer. We have that now as well. And it actually works miracles when you're trying to prove timely matters on timely denials that we receive. The accounts will then be ready to obtain appeal determination once the cases just circle back to the staff. So again, you're eliminating that manual intervention of having the staff pick up the phone and saying, was the appeal delivered at so-and-so time and date? Denial prevention overall. I'm going to go over a little bit more in detail on this on the next slide, but you want to be able to identify and quantify trends by carrier for more effective follow-up. You want to be able to have the ability to identify denials that are preventable to make that internal department change or to avoid, obviously, any denials in the future. And lastly, we have revenue cycle analytics, perhaps customizing a dashboard in which you can capture denial trends by volume, payer, balances. You want to see the money that's being currently impacted by in your rev cycle. And as a facility, you want to analyze these payments that you're being received by the payer to determine if they're being approved accurately or if you're getting full reimbursement. Sorry, next slide. So a little bit of that denial prevention. And there's like 3 sectors that I usually review. First off is pre-billing and coding validation. You want to identify clinical documentation and coding issues, obviously prior to billing to avoid any billing errors. You want to continue to perform routine internal coding audits within your departments and teams, and obviously be very transparent to those coders and billers and or physicians that are not documenting correctly in real time and letting them know where those errors are that you're finding. Some strategies are identifying the root causes and case strengths of the denials, identifying higher dollars or accounts that may be at risk for denial to avoid that rejection in the future. And of course, analytics, tracking and reporting, technology, tools, and education. And in order to have what I believe a successful appeal is if the case has merit to file, we always say appeal. You want to identify, once again, the case strength of that denial and ensure that you capture any comprehensive clinical documentation for the potential for a higher potential in payment, and include any attending or specialty physician for additional for documentation or feedback if needed. Especially if you're going to go to second level, you want to make sure perhaps you're escalating something to a peer-to-peer prior to, and you want to automate and track appeals process and timeframes. Once again, review and utilize those payer policies. That's where you can pretty much hold them by, their legs or feet and say, this is what the policy says. Why aren't you abiding by it? So making sure that your care management team is always reviewing those contracts and payer policies. And that brings me to my next bullet: utilize managed care contracts and add clinical criteria. So some key elements for analytics: you want to manage denials, most importantly. Again, identifying root cause and payer patterns. You want to evaluate your reimbursement, so managing the cost and maximizing that cash. Increasing the knowledge, once again, of your payer contracts in order to maximize that cash to your benefit. And then the ability to focus on metrics and provide targeted education to the front end of the cycle, because that's where it all begins, is your front end. So here's just a quick grid of what I like to show what the front end and back end leadership team or kind of circle of life should look like. You want to always make sure that you have your patient access insurance verification team on board, your patient's financial services, your peer nurses, your finance leaders, care coordination, utilization management, your physician champion advisor, your chief ED physician, obviously, and then again, managed care. So before you go on, Andrea, because I'm going to send it back to you. So as healthcare revenue cycle management continues to evolve, it is the hospital's responsibility, to maintain that highest level of patient centric care by working on this unit. but this also includes revenue recovery. So you want to make sure you have a clear path of communication with all those teams that I said before in that prior slide, and ensure that all the stakeholders are involved for be able to reach that SMART goal. So Andrea, I'll hand it back to you.
All right, thanks, Sandy. Yeah, I love that she finishes on the teamwork slide. We actually didn't even plan that. Like, she usually just finishes on that teamwork slide, and my next slide is about teamwork. Because if we hear from Bill Gates, we have to hear from Steve Jobs. And Steve Jobs said, great things in business are never done by one person, they're done by a team of people. And that's my experience as well. We need multiple different layers of experience and understanding to be successful with an initiative like this. You need someone like Sandy that has the clinical experience and the appeals experience to be able to guide which direction you're taking. So when I say teamwork makes the dream work, you have to represent those multiple levels of organization in your team. You have to look at people from the perspective of attitude, not necessarily just skills. And when I say this, I get some mixed reactions. So I'm a little bit cautious, but I think it's really important. When you're building a team that's going to work on these kind of initiatives, you want that squeaky wheel employee, the person that complains about everything. And when I say it, you know exactly who I'm talking about in your organization, because you need somebody that's not uncomfortable criticizing. And a lot of us are. We want to say that things are okay because they are okay, but could they be better? The answer to that is also yes. So how do we make them better? You look for the person that's not afraid to tell you everything that's wrong. Doesn't mean we're going to do every single thing that they say, but we appreciate having that person as part of the team that's comfortable saying what nobody else wants to, right? So look for that person. But then you're also looking for people who are positive, people who are servant leaders, meaning they can lead by serving you and by helping someone else to be better and to grow. So those types of people are really important within this team. Your leader really needs to have that servant leader mentality. And you need to also, of course, bring in developers, data analytics that are focused on this project, because making sure that you have someone that's going to carry that banner and get the engagement from every other person that you need involved in the project is really critical. So getting that right leadership, that right ability to criticize, and of course, you know, the actual skills you need, right? The development skills. Keep in mind that RPA and AI aren't a particular technology, they're a set of technologies. So there's many different people in different directions that you could go in where you could use different technology skills. So it's not just a single set. And you want to get that feedback throughout your process. So you want to make sure that you have that right feedback. Somebody's giving you that criticism constantly. So once you have your team in place, you're ready to start building. Oh, I apologize for this typo here. I hope it's not going to drive anyone too crazy. And what we want to look at are the key elements for success with AI. So the first one here, and I want to point out that this is from an article about how artificial intelligence learns with farmers, and yet it's just as applicable to healthcare. So the first thing here is asking the right questions to provide the most value. And again, that's going back to that squeaky wheel employee that's not afraid to talk about all the things that are wrong to help you focus your resources on the problems that you're trying to solve. But not everybody knows how to ask good questions, and it's really important. I don't know if anyone's ever read The Hitchhiker's Guide to the Galaxy. Sometimes I look around the room and people are nodding, and sometimes I look around the room and everyone's face is blank. But it's a novel where they build a supercomputer to answer the ultimate question of life, the universe, and everything. And they get the answer, and it's 42. So they never knew what the question was, right? So we really need to make sure that we have the people that understand how to ask the right questions. The second thing is the availability of data and the ability to cleanse, steward, and secure that information. So first of all, that robotic process automation, can help you to supplement with data that's not consistently in your system. So you can use it to go out to other data sources, retrieve information, and make sure that your data is clean, you have it consistently, and that you understand it. That comes back to AI again as well, making sure that the data that we have is consistent, it's accurate, and it's something that we want to build on. So we've taken the right steps on these denials. We're looking at the denials that we got paid, not the ones where we were rejected, to see what are the commonalities among these payments that help us to determine which accounts we should be appealing and what actions were the right actions. So we want to make sure that we're successful in a lot of those cases in order for our machine learning to pick up and make the right choices going forward. We also need to make sure that as we're doing that, we're documenting. We're documenting what we're building, we understand it. Otherwise, at some point, we're going to lose track and we're not going to be able to understand the things that we're building and why it's making the decisions that it's making. Of course, we need the diversified talent that brings the right domain, math, engineering knowledge. Again, we need programmers, we need developers, we need data analysts, and hopefully they are already skilled in the technologies that we've chosen for the project. If they're not, then they have to get that training, and or we have to bring in people that also have that knowledge set. Technology to process the data at scale. You can't manage an AI if you don't have a server that's large enough to handle your data, right? So that's just simple, it's just infrastructure, but it has to be there or else you can't do it. And partnerships to accelerate innovation. Don't ever think that you have to do everything yourself within your own organization. You can feel free to find partnerships. There's people out there that are doing this, that have solved these problems already, and they can be great partners for you. I really love the quote that's here. First, you solve the problem, and then you write the code. So first, we build that team. They're together. They're asking the right questions. They're understanding what the problem is. They know where they're trying to go because they have that goal in place. And then we start writing code that's going to solve this problem, and that's going to help us get where we're trying to go. So when we talk about success, we also need to look at the continual improvement model. When we're doing this, when we're working on robotic process automation, artificial intelligence, and really in everything we do, we focus on value, and we understand and recognize that value is co-created. I'm on the IT team. If I build something and Sandy's team doesn't use it, I have not created value, I've wasted time, right? So by understanding that value is co-created by the team using the technology that I build, I'm able to increase that value. And how do we do that? Well, one of the things that we do is we work with the staff and we train them on what the technology is doing. How do you use the technology? And that's how we help them to create value. So we understand throughout the business what the vision is, where we are, where we're trying to get. And once we get there, how we keep improving and how we keep watching it to make sure that nothing backslides, right? Because something that can absolutely happen when you're integrating technology is it works today. In a year from now, it stops working and no one knows that it stopped working because no one's looking at it, right? So we utilize the continual improvement model. We keep watching the things that we're doing. We make sure that the staff is involved and trained on our technologies so that we continue to get that value. And we have all sets of eyes within our organization watching to say, is everything working the way it's supposed to? Is it doing today what it did yesterday? Or is it doing something more or something better? And understanding that use case in action helps us with natural progress. It leads to natural progress. So as we moved forward with the creation of one set of rules, the next steps became clear because we understood where we were trying to get. We understood what we had done so far. And as a result of it, you build an automation that puts things into categories and you see where your biggest inventory is sitting, right? Once you see where your biggest inventory is sitting, you know what the next step you have to take is. How do I divide this further? How do I get the next step taken on this, which is my largest inventory, right? We talk to people throughout the process. What are you seeing? What are you doing? How can we help you to create more value? And with that, once you have that robust program, you know, you're pretty much in a good position to build robotic process automation, to build artificial intelligence, and to expand any use of rules-based automation. So here I'll open things up to questions for Sandy or myself. I don't know if you've had any roll in during the presentation, Lena.
I think there was one additional person who joined us.
Okay.
Mm-hmm. Are there any questions?
I love no questions. I love questions, and I also love no questions, guys. So thank you.
Oh, well, if there are no questions, I want to thank our presenters. Thank you so much for this information. Very informative. And we'll be sure to share it not only on our website, but with the attendees who were not able to make it, as well as the recording.
Well, thank you for having us. And it was a lot of information, but it's good information. So at least you guys will get the presentation as well. And if you have any future questions, we're here.
Absolutely. Thank you so much.
Thank you, guys. Have a great rest of your day.
Thank you. Have a good day.
You as well. Have a good afternoon.
Bye. Thank you, Lena.
You're welcome. Bye-bye.
Bye.